All right. Yes, and just so people know, we are recording the presentation. WICRI does record the presentations and then make them available afterwards. So that's great for you if you want to go back to the information and just know that other people might be accessing it as well. So I'm Sandy, and my partner in crime, Jeanette, where did she go? Oh, I think we lost Jeanette. Oh no, Jeanette. There you are. We are your U of A center leaders, co-leaders for the ENRICH program. And so the point of this presentation today is just to give you information on this exciting new program and then answer some questions about it. It's hot off the press. And I think, to my knowledge, we're the first site sort of doing a whole site meeting about this. So we're excited to share. So basically, this is our agenda for today. We'll just introduce the different parts of ENRICH, and then we'll also go through the specific application process here at U of A and through WICRI. So I'm Sandy. I'm in occupational therapy, and I do child health research, mostly grounded in social sciences. And my colleague Jeanette, who I think is in a semi-meeting, is a pediatric neurologist at the U of A as well. Oh, there she is. Jeanette, do you want to introduce yourself?
Sorry, guys, I just finished in clinic. Yeah. So, sorry, I'm Jeanette Mile. I'm a pediatric neurologist. I'm a research lead for general pediatric research, and I'm also just a site lead for ENRICH. So I'm very excited to be part of it, and you have a great session. I'm happy to answer any questions, and I'll be moderating the chat, so feel free to put the questions in.
Great, thanks. So this program emerged out of a previous program, the Canadian Child Health Clinician Scientist Program, or CCHCSP. And so this is much bigger and much broader, but we've always had two site leads at U of A because we try to sort of bridge different types of scholars that are engaged in child health research, as well as people that do different types of research. So that's a long-standing tradition at U of A, and we're both happy to answer any questions. So when you reach out, you can email both of us, and then one of us will respond. So we would like to acknowledge that the University of Alberta is located on Treaty 6 territory, respects the histories, languages, and cultures of First Nations, Métis, Inuit, and all First Peoples of Canada, whose presence continues to enrich our vibrant community. And because we're online today, you may not be situated in Treaty 6 territory right now. And so as researchers engaged in research in perinatal and child health, we do think it's important to reflect on how the work we do might influence or represent Indigenous peoples in Canada. This program, ENRICH, has a very intentional consideration in their funding streams and who they've partnered with, and all of the resources that they will produce, which you'll become familiar with. And then also to thank WICRI's funders, the Stollery Children's Hospital Foundation and the Alberta Women's Health Foundation for making this session possible. Okay, so now sort of the meat of the presentation. So what is ENRICH? What does it do, or what will it do? So it is focused on perinatal and child health research, and it really is about increasing capacity for high quality, impactful research. It really is about training the next generation of leading researchers across Canada. And it really does value interdisciplinary training and approaches. It also really appreciates and understands the importance of mentorship and different types of mentorship. So all of those pieces you will see once we go through what the different pieces of ENRICH look like, you'll see those really embedded throughout the program. Really importantly, the original creator of the previous program always said that these programs are not a bank. Some aspects do come with salary support, but that's not the essence of the program at all. It's really about that high quality training. So who we are, this program is massive. So there were 163 or 193 applicants on the CIHR proposal. I don't think I said it. So Dr. Susan Samuel, she's a pediatric nephrologist, clinician scientist. She is the PI. She's situated at the University of Calgary. So you'll see here, there's a number of networks, academic institutions, including WICRI, and then various groups across Canada that are all part of this. So it's incredibly collaborative. And I'm sure that you're familiar with many of these. And there's some that I had not heard of before. So there's many, many partners. And like I said, it's really a training program, and you'll see here that it goes across a lot of different training levels. So from undergraduate into early career investigators, it has specific streams and resources for clinician scientists, and it has specific funding opportunities for Indigenous and Black scholars. So this is what we're mostly going to talk about today. So ENRICH has sort of three different components or streams to it. I'm not sure, actually, maybe I'll pause for a second and maybe if we can use the raise hand function. I'm curious how many people are trainees. So that could be graduate students, postdoctoral fellows. 1, 2, 3. Okay, so a number of you. Okay, and then how many people would be, do we have some early career researchers on here? Okay, and what about supervisors or other sort of senior scholars? Okay, this is a really great mix. And then do we have some people who engage in research as other ways, maybe research coordinators or administrative staff? Okay, this is great. What a nice mix. So then I will mention the Illumination Program. So this program offers an opportunity for people to participate in the ENRICH program on a paid basis. So for example, there is a phenomenal annual symposium every year. And so people are able to pay to attend that symposium if they want, or the other components. We didn't go into depth in the Illumination Program at all today, but I would direct you to their website where there's a lot more detail on that. And then we just wanted to highlight the competency framework. This is hard to see, it's lots and lots of text, but just so you can see that it's not, for example, it's not just about research methodology, that it really does go through a number of key areas around, for example, learning about management of programs or management of budgets or management of staff, through to ethics and child health research, and so on and so on. So you can see here that there's lots and lots of different pieces that are integrated into the training program. And then I'm not sure if I said this, if you do have questions during the presentation, we can address those. You can just raise your hand or put it in the chat, and then if not, we'll wait till the end. So RISE is coming soon. It's not open yet. And this is an open access training hub or resource for scientists engaged in perinatal and child health across Canada. And this in particular Once it's open, which should be in the next 6 months or so, we will use at U of A to have some small group sessions, probably about once a month, with learners just to go through case studies or in the past it's been situated around case studies, but to go through different aspects of the curriculum in a really systematic way. Once you go through the curriculum, then there are formal certificates that you can have on your record that I suspect will be recognized as this program gets more and more opened up and recognized across Canada. So I put my email at the bottom because once this is active and we start those sessions, I do keep a listserv of anyone who wants to be invited. We do try and circulate it broadly as well. But if you do want to be on that listserv, if you can just please send me an email and I'll make sure to have you added so you get an invitation directly to your email and not, for example, through the WICRI bulletins. And there's lots more information about this online, or there will be. So the enrichment group is not fully open access like RISE. This is the more competitive part of ENRICH. And these can be learners from undergraduate up to a new investigator level. And then if you are a learner who wants to apply to this program, you do need a local supervisor or mentor that will also commit to this program. So for example, if you go to the annual symposium, which will be next year, it's in Halifax, so it goes all across Canada, then your supervisor is expected to go as well and engage in the network of ENRICH. You do have to be engaged in perinatal or child health and well-being research, and that comes in many different shapes and forms. And you do need to be a Canadian citizen or permanent resident. So these are the 3 different pathways to potentially get into the enrichment program. Pillar is what we're mostly going to talk about today because that is open now with a quickly coming up deadline. But then we will also quickly introduce the REACH program and SOAR. So Pillar is a 2-year training program as part of the ENRICH program. This is open to WICRI graduate students, fellows, and early career investigators. So all candidates, I'm assuming that you're WICRI members because you're on this webinar. And so how it works now is that you need to have a supervisor or mentor if you're a trainee who is a WICRI academic member, and you can check that through WICRI's website. So this program is geared towards trainees and early career researchers who want to gain the skills and competencies to pursue an academic research career. That's the primary goal. That being said, they do have curriculum for other sorts of post-training careers as well. So it is somewhat open. It really provides access to the curriculum and to the mentorship services to build networks across Canada, and then participate in a variety of different activities such as the annual symposium. So the Pillar program does not provide any salary support. It also doesn't cost the trainee anything because WICRI supports 2 trainees a year at U of A through their funding. And then if you're in the enrichment program, I said there was a certification. And so these are the different components that come with that. So you do get all the RISE curriculum, and then when it's completed, the certificate. You can also join, they have more intensive enrichment groups across a number of different topic areas. So you can join one that is of most interest to you, and it will come with experts in that area that guide the process. You do get an annual progress review and come to the symposium. You are assigned 2 mentors, and those might be career mentors, content mentors, across different areas that are assigned to you, and there will be a process for that. And then you have your individual research development plan that you also then review annually with your mentors. So it's, like I said, that mentorship networking piece is really important. And I think that really comes across here when you look at the different components. Okay. And so for pillar, like I said, this is coming up very quickly. So typically we would ask, if you're interested in any program, that you contact Jeanette and I well in advance. 1 to 2 months is not actually really an option right now, but you're here today. And of course, if you have questions beyond what we can address today, then of course you can reach out to us. There is an expression of interest form due through WICRI by November 7th. And I'm going to show you that so you can see what it looks like. And then we have no idea how many expressions of interest to anticipate. So there are up to 2 spots at U of A. And so this is our best guess at a process. If there's 2 applicants who both seem like a good match, that makes it easier. If there's 20 applicants, then that's a little more work for Jeanette and I. So the plan is that initially Jeanette and I will review all of the applicants. And then if we need to, then we might go to WICRI and to some of their different committees if we need some additional deliberation. So the board of directors, the program advisory committee. So like I said, we're not quite sure what it's going to look like, but it will be a fair, systematic process if there are multiple applicants. And so I'm just going to move some things around on my screen so I can show you what the form looks like. Okay, can you now see, Jeanette, can you see the new form? Okay, great. So there is a QR code at the end of this presentation that'll take you directly to this. And I'm just going to make this a bit longer. There we go. So if you haven't used REDCap forms before, they're very, very user-friendly. And we tried to make this as simple as possible while getting the information we need. So the first part is quite self-explanatory, lots of drop-down boxes that make it really easy for you to indicate where you are on campus, different clinical disciplines. And the reason why that's important is some of the awards are specific for clinician scientists, and based on registration, this is who falls in that list right now. If you are if you're a registered health professional outside of these, you can reach out. So for example, I think we've had kinesiologists reach out in the past who weren't able to apply at that time based on their college structure. But anyway, if you're outside of this, then do feel free to reach out. Pretty self-explanatory. Okay, and then this is the important piece. So this is what we're asking you to tell us is why you want to participate in this pillar program, and what you hope to gain from it. And then also a little bit about how your training environment will contribute to your productivity and also help you develop your skills and to help you reach your goals as a perinatal child health researcher. It's got some word counts, so just a paragraph. And then we've also asked here as well if you want to be added to our list for those monthly sessions going through the RISE curriculum once those start. So you can also just click here if you plan on putting in a letter of intent. Any questions on that while I move my screen back? Okay. Okay. So again, the important deadlines before November 7th. It's a quick turnaround for us, so we'll be going in later on the 7th or on the 8th to see what's there. And so then we can have it approved by the WICRI executive by December 1st. And then we need to share our candidates with ENRICH, I believe, by December or January. So it's quite a quick process to get going this year. And like I said, part of that will be attendance at the National Symposium, which is in Halifax next May, late May next year.
We have a question, Sandy.
Yeah.
From like Elise. I hope, Elise, I'm saying your name right. Are applications restricted to full-time trainees?
That's an excellent question and not one that I thought about.
I don't
I'm
know.
gonna
We might have to find out the answer and just maybe email it to everyone. Maybe if some other people are interested in the answer.
So I can tell you for their sort of top level salary awards, there is a commitment to research that I can't remember what it is right now. It's not 100%. I believe it's between 50 and 75%. For the pillar awards, I think, and I don't know if any WICRI people have an answer or if this is a conversation that maybe we should have outside of this meeting. That's a really great question. So I guess the answer is we don't know yet, but we will figure it
But
out.
we will find out.
Yes.
That's
Any
how
other
new the
questions?
process is. We're still trying to figure it out.
Yeah. Yeah, all of this just became live like now, and some of it isn't live yet. So it's very new. Okay, and then we just also wanted to introduce you to their other awards that will be opening up soon. So they do have ENRICH applications, and these awards are for people that hold another salary award. So you might hold a WICRI graduate studentship or a CIHR award, or there's a whole number of sort of provincial and national awards that would qualify. This program doesn't have any deadline, so it's on a rolling basis, and it is first come, first serve as long as the criteria are met. And what this does is, again, it doesn't come with any additional salary support, but it does open up all of those resources and experiences that are part of the ENRICH program. So the curriculum, the network of mentors, the formalized progress review, all of those pieces would be included with this. And then the other difference between this and our pillar awardees is the institution is expected to pay costs to go to the annual symposium for ENRICH trainees, and they are expected to go as part of the ENRICH family, as it were. And this can be anywhere between 2 and 4 years. So if this is something that might apply to you, I would first direct you to the website, the ENRICH website, to see what additional information is there, and then you can reach out to us. To my knowledge, this isn't open yet, but I haven't asked in the last probably 2 or 3 weeks, and things are rolling out so quickly that it could be open now on the website. And then finally, these are their sort of highest level awards. They're Soar Awards. This will be available to you September 1st, 2023. It is once a year deadline right now, and these are their salary awards. So as you can see, they have specified really specific criteria for the awards. So there's the Summer Institute for Black and Indigenous students. There are doctoral awards for Black and Indigenous scholars. And then there are doctoral, postdoctoral, and new investigator awards for clinician researchers. So those are clinician scientists who are part of a registered health profession. These are very, very competitive. If ENRICH is anything like the previous CCH-CSP, they were more competitive than your standard CIHR awards because of the phenomenal training program that is around them. I think there are 2 awards per year in each of these categories. I'm not 100% on that, but it's not big numbers, but it's an amazing program. So if you think that you might be competitive for these type of awards and you do meet their inclusion criteria, please reach out to us well in advance because it's quite an extensive application process. Okay, so in summary, just to remind you, so that pillar program is active and the submissions are open right now. The ENRICH program will open soon. That's for if you already hold a salary award, and then the Soar Awards will be next September. So you've got lots of time to look at the information for that. that we're going to start our sessions here as soon as the site's open, and it should be open in the next 6 months and maybe even in the next few months. So if you want to put that on your radar. In the past, we've always just kind of done lunch, hang out as a group, sort of lunch sessions, but depending where people are at, we could be open to doing them in person, on Zoom, or hybrid. So we can work with the needs of the group. And then please do go to the websites. They're really, really helpful. And so there's 2 QR codes there for you. One, WICRI's information on the ENRICH program, plus a link to the ENRICH website. And then one to that application form for a pillar if you're interested. Okay, and that's all that we have. So there's our emails as well.
Yep.
And I think our emails are also on the WICRI website as contacts as well. So you will be able to find us. And I see some stuff going on in the chat.
Oh, I don't see any other besides Elise.
Oh, no, it's just links to the form. Okay. So are there any?
Oh yeah, there's one. Can one apply to multiple programs at the same time? That's an excellent question too.
Yeah, so like I'm thinking for Pillar and Reach, I think some of it depends on interest. So the difference between Pillar and Reach is Reach, your institution would cover your cost to go to the symposium. Pillar, it doesn't. Reach can go longer engagement in the program because it's up to 4 years if you have an external award. I think that we want to engage the most people that we can as an institution. And so I think that we would maybe engage the most trainees possible, because most people will not qualify for Reach or Soar, right? Does that make sense? And then if you have Pillar or a Pillar award, then yes, you can certainly apply for the Soar award. Yeah.
And there's another one, Sandy. Elizabeth is wondering how the program is designed for early career researchers and who is actually considered early career researcher in the program.
So an early career researcher is, I think it's up to 5 years in your position. And I know it's very clearly indicated on the website. I'm just trying to see if I wrote it down anywhere. So do you mean like how they're scaffolding undergraduate to early career in the same curriculum?
Probably, but yeah, if Elizabeth, maybe you can, if you don't answer, maybe you can clarify.
Yeah, I'll do that. So by that, I'm wondering, like, if you've just started your position, and you have like just a normal position teaching and all that. So how is it designed for somebody who is just starting off as an early career researcher? So when do you get, or even you have meetings with your mentor and all those other aspects of the program?
So are you asking how, like, trying to fit this in with all of the demands as an early career researcher? Okay, yeah, that's an excellent question. I've been there. So when if you get a salary award, then typically that would buy out some of your other obligations so that you could have more protected time to develop your research program. For the other awards, it's not as intensive as maybe it looks. So I think it would fit in. So for example, if we have monthly sessions here, they'll be probably over lunch once a month. The mentorship, when I was a trainee in the previous iteration of this program, and we had set meetings with our mentors at the annual meeting, and then 1 or 2 other scheduled meetings throughout the year. So it was really manageable. And I think what I took from the program, even though there was some time engaged in the program, it made me that much more successful as an early career researcher because I knew, for example, sort of what to prioritize, how to focus on things, and some of those strategies.
That's good.
These are really good questions. Lindsay, can you move from being a postdoc to an early career researcher while still holding the same Pillar Award? That question has never come up in the 2 years of, or 3 years of planning ENRICH. Wickery, jump in. I would think if you're at the same institution, then it shouldn't be a problem. If you moved institutions, no, because Wickery is actually funding you. So if you're no longer associated with Wickery. Yeah, good question. Any other thoughts or questions? To apply for the Pillar program, you don't need to fall into those specific categories of clinician scientist or Black or Indigenous scholar. You can be engaged in perinatal child health research in any way. You have to be a trainee, so you have to be a graduate, undergraduate, graduate student, or early career. By grants, do you mean salary awards? Like an award to you, Khalid?
Oh.
So for the RISE program or for the REACH program, it would be a salary award. So if you, for example, got a Wickery graduate studentship or a CIHR doctoral award or new investigator award. Yes, Tanya.
Just correct me if I'm wrong, the Soar Awards, so the ones that have salary, are
Yes.
only open to early career researchers who are on a clinician path or a health professions path, correct? Like that's not
Yeah.
open to just PhD early career researchers, or is it? Or we don't know.
The Soar Awards have doctoral, postdoctoral, and new investigator clinician scientist awards. And then they have doctoral awards for Black and Indigenous scholars. And then they have the Undergraduate Summer Institute that I was not part of planning, so I don't have details on that. And I'm quite intrigued to learn more. I think it's probably still in the works. And then I guess the other thing I'll say is if you do become part of the ENRICH family, like when I was part of the previous iteration, I still collaborate with so many people from across Canada that I met through workshops or annual symposiums from that program. It's a real networking gem. Yeah, Elizabeth.
Yeah, I just following up on Tanya's comment. I'm wondering, with a clinician, we are not, or even public health or social sciences are not included in that, right?
So the clinicians would be people that are registered, like are a registered health professional. Your research could be situated in social sciences. Does that answer your question?
Yeah, so that means that you must be having some kind of a registration, like a certification.
Certification in Canada, yeah.
Okay.
Yeah, the training doesn't have to have happened in Canada as long as the registration now is in Canada.
Okay.
Yes.
Thanks.
Yes, I can put the QR codes up again. Not a problem. Does it work if I, oh, there it is, it's still there. There we go.
And just so that everybody knows, the presentation slides will be posted on the Wickery website. You'll also be able to access the Zoom recording. And also next Wednesday, we will be sending out a recap of this and a link to the Zoom and the presentation slides in our weekly bulletin.
Great. Okay, so if there's no more questions now, and some of you, I'm guessing, might go spend a little bit of time on the websites and then have other questions. So please reach out to us. We are still, like we said, I don't remember if we said it just with us or with the whole group. This is so new. And even though we were part of writing the grant and the development, there's so many moving parts that we are still becoming familiar with all the details as well. So you'll just have to bear with us there. Yeah. Jeanette, do you have anything that we missed?
No, I think I think Sandy did an amazing job with the presentation. Great questions, guys. So the questions we haven't been able to answer, we'll look for the answers.
Yeah, and hopefully we'll see some of you at our U of A group once we get up and going.
Exactly. And hopefully you'll be applying, guys. Sounds like an interesting opportunity.
Yeah.